Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. I'm Michael P. Coleman, Content Director for Brother Be Well. In the U.S., 1 in 5 adults and 1 in 6 youth experience mental illness or a mental health disorder every year. In 2019, almost 25% of adults with a mental illness reported an unmet need for treatment. Part of the problem is that people don't know what their options are or how to access those options. Often, even those with comprehensive private health insurance don't know how to access mental health services or how to navigate a private mental health system. Today, we're exploring California's private mental health system. And my partner for today's conversation is a name you know, a face you know, Cherie Kreiner. She's a registered nurse and vice president of the Capital City Black Nurses Association. Cherie, how are you doing? Welcome back.
I am well. Thank you so much for having me yet again.
It's really good to have you. Let's get right on into this. I had a couple of revelations, Cherie, as we were getting ready to talk. And one of them was the disparity, and it's huge, between mental health services that are available to those with private insurance compared to those on the public healthcare system. Before we dig in deeply to the private mental health care system, you're a nurse, and I'm wondering whether that's also the case on the physical health side.
Right. So when you think about publicly funded health plans, you think about budget, right? We always hear our politicians and everyone talking about budget. So there's a certain amount of money, and then that money is allotted to each type of service based on the need that they've assessed, right? So you only have so much, and they can only do what they can, right? I look at it like they say, well, make it enough when it comes to healthcare in general, or specifically for mental health, which oftentimes doesn't make the cut. Um, Physical health seems to take priority with health policy time and time again. So you're kind of restrained in the public health arena because the pot of money is the pot of money. They offer what they can. That can change from year to year or term to term, depending on any legislation or rules and how they manage the budget. Right. So there could be limitations automatically from the jump. Private insurance basically is a contract between you and that private insurance company. They say for this price we offer, A through Z. And so you kind of get to shop and choose with your private insurance what meets your needs and at what cost and what's included, what's not included, and what your out of pocket costs may be, or we may know them as co-payments or co-pays. So private insurance gives you an opportunity to see upfront what's offered and make a choice. In public insurance, you get what you get and don't have a fit, right?
Yeah, I appreciate that. That's great information to have. I understand at least now why it's set up, why it is the way it is. Cherie, a lot of people with serious mental illness don't intentionally decide to drop off of commercial insurance. Sometimes it's the illness itself, especially if it's inadequately treated, that can lead someone to lose their jobs, for example, and then that might land you here in California on Medi-Cal. Overall, I'm wondering what your take is on the quality of the continuum of care for those families that decide to go off of commercial insurance for whatever reason and go the public route.
Right. So it's always really unfortunate. And, we always, Michael, talk about the social determinants of health, right? Here it is yet again. There's a financial reason that you have to make a decision about your health care, which is always difficult. So what I say is same approach, really, whether it's commercial insurance, private, if it's public or government insurance, understand what is offered and what resources are available to you. So making sure to know that even if there are limited resources, what do they have to offer and how do you take advantage of what's available? So I would say knowledge is really power, especially when it comes to navigating the mental health system because it's limited no matter where you go. really understanding what it's worth for you, and then also considering community resources. And then also, they have a lot of fee for service or pay for play options. Now they have services on apps and other ways to connect to mental health professionals. So you really are in charge of your care or your family members that may be taking care of you. And you can make an informed decision is always the best decision. You make a decision with all of the information and you do what you can with what you're given.
And that's certainly what we're trying to do here at Brother Be Well, and with the help of people like you, Cherie, giving people all the information they need so they can make the best decision about any one of a number of choices they're going to have to make. I want to talk about, and I know you know about this, Cherie, the 1996 Mental Health Parity and Addiction Equity Act. It led to the Mental Health Parity Law. And that law provided that large group health plans can't impose annual or lifetime dollar limits on mental health benefits that are less favorable than any such limits imposed on medical or surgical benefits. So, my question for you, you're a lifetime mental health professional, you're a lifetime healthcare professional, and you've always advocated for mental health parity. What would you have to say about how well the private mental health system has done to bridge the gap in the 25 years or so since that law was passed?
Right. So, Michael, I feel like everyone's struggling, right? It's kind of like an ethical dilemma, I think, in the healthcare arena, right? Um, each organization has to prioritize their care and what's offered. And when I say prioritize, it's how much care is offered, how many providers are recruited. And it seems like you can never get enough. Like I have private insurance as a healthcare provider, and I would consider myself someone that has really excellent coverage and a lot of great access. But I still have access issues getting into a provider myself because it's a widespread problem and it's only seen worse in the public sector, but it's still not adequate enough across the board in most arenas. And I'm a person with a job and full benefits, and I still have access barriers to mental health services that are adequate or timely. Sometimes it's the timeliness because we don't have enough providers, so you have to wait. All of those things are indicative of organizations trying to um, meet the order and rise to the occasion, but still falling short. I can tell you, as we experienced a pandemic, it really showed all those pressure points and where we were cracking at the seams because more of us needed mental health, and it was very hard to get it, even with private insurance.
I could imagine. First, I just want to say it's surprising to me, and I think it might be to some, that you as a healthcare professional, I think some of us think you got an inside track, that you might have it a little easier accessing those systems than the rest of us, but it sounds like that's not the case.
Nope, same thing. We're all, at the end of the day, on the patient facing side, I'm a patient, I'm a healthcare consumer, and I've seen some of the same needs not being met, even amongst those of us that have private insurance. Or, like I said, a lot of times it's timeliness. Let's say the availability is there, but maybe the timeliness is behind. If I have to wait 2 or 3 months for a provider, and I pay my premiums every month, that's a difficult thing to deal with.
Yeah, yeah, I see it. I see it. Appreciate you sharing it. We produced, as you know, also Cherie, a whole separate video here at Brother Be Well on navigating the public mental health care system. So let's zoom in now on the private system that we're talking about in mental health care. For California residents, at least, and that's where we're coming out of, is it as simple as starting with your primary care provider rather? That seems rather obvious to me, but I want to ask you, is it just that simple? Is that where you start?
It is, but I would encourage you to start before that. If you have an employer-based insurance plan or you pay out of pocket, um, then you want to know the plan that you choose meets your needs. And what I mean by that is look and see what benefits are covered and what cost that comes at. If there are any copays, if there is a annual fee that you have to pay up to a deductible up to a certain amount before your insurance kicks in to pay for something. So you want to understand those rules of engagement and really pick an insurance that fits best for you. Like, for instance, if you know that you already have a mental illness or someone in your family or one of your loved ones, and you know that you're going to consume a lot of those services, then looking to see what each plan has to offer is really important. Not only how much it costs your monthly premium, but like I said, if there's an annual deductible, so an amount that you have to meet before the regular insurance kicks in, and then also copays. For instance, if you're going to group therapy or individual appointments, sometimes there's a copay for every single visit. And let's say you routinely use those services once or twice a week, you have to consider that financial impact. So you want to lean towards, like, for instance, I used to always go for a plan that had lower copays. When I made less money, I wanted lower copays because, if I needed something urgently, I wanted to make sure I had access to it. And then, later on, I changed to where, maybe I'm okay with the co-pays, but a lower premium. So understanding the type of insurance and what benefits are covered is where you first start so that you don't fall short. Because when you go to see your primary care provider, they're going to give you the referral. You're going to go in the right direction. But if you show up in your mental health provider's office and their services that you need are unexpected costs, that sometimes could also hinder you. So you want to be mindful of all of those aspects as a healthcare consumer.
One of the reasons I love talking to you, Cherie, is we almost and sometimes read each other's mind. Because I was going to ask you about the plan next up. Is there anything
Mhm.
else regarding exploring that plan that you can think of? Because I think it's really important. I didn't think that it should come before the conversation with the primary care provider. So I'm just wondering, while I've got you here and we're talking about it, can you think of anything else related to that search for the right plan that you might be able to impart for our viewers?
Yep, just remembering the key points. How much is it going to cost you per month? How much are your co-pays for the services that you're going to get? If there is a deductible, how much is it and what things go into contributing to that? Sometimes, often really, your physical health deductibles, whatever you're paying in co-pays and other money goes towards that deductible, but really understanding. And if you don't understand it, because sometimes it's too much paperwork, then call your member services and talk to someone on the phone and ask those questions. Write your questions down ahead of time, call, ask those questions so that you understand what you have, especially because most plans from employers specifically, really you only have an annual opportunity to sign up for a different plan or open enrollment, they call it. So, really understanding that what you decide, you may be stuck with for a year, even if it's not what you really wanted. So, take that time seriously, ask questions. If they offer any seminars where you work about benefits, go check it out. Sometimes there's stuff that you don't even realize that you have access to. The other part I would remind people of is if you work for an employer, that another good option is a healthcare spending account that tax shelters that money. It takes it out ahead of time. So if you do have a lot of copays or medications or treatments that you need for your mental health, that could be tax-free dollars that they take from your payroll and set aside just to make sure you have enough money for those services. So there's lots of options. Figure out what's best for you and what makes the most financial sense, right?
Yeah, really. So much great information and great tips there, Cherie. I really appreciate the thought that went in that one. You covered three or four things that I hadn't thought about. Really appreciate it.